Good morning. For PEI, and briefly mention Canada and the New Brunswick situation, masks, how we can adjust to the changing seasons in the midst of a global pandemic, and misinformation circulating about COVID-19, and also how COVID-19 compares to seasonal influenza. There is one new case of COVID-19 to report today in Prince Edward Island, a female in her 20s, a rotational worker who traveled outside the Atlantic bubble for work purposes. She is self-isolating at home and has mild symptoms. Contact tracing is complete and close contacts have been tested and are self-isolating. On the first required test on day 0 to 2, this individual was negative. However, the second test on day 4 to 7 was positive. The fact that she was initially tested negative and was positive a few days later illustrates a number of points. A negative test reflects a single point in time only and does not guarantee that future tests will be negative. Testing does not replace self-isolation. The testing and isolation requirements for workers, those who are either work isolating or are rotational workers, are in place and should be followed. Our processes and systems to ensure early identification, self-isolation, testing, and quarantine are effective in containing the spread of COVID-19 in our communities. In PEI, we are doing a great deal of COVID-19 testing. We are second in the country behind Ontario in testing per capita. PEI continues to be at risk of importation of COVID-19. Related to this new case, anyone who traveled on the following flights on October the 13th should monitor closely for symptoms of COVID-19 and arrange to be tested if they feel unwell. Air Canada Flight 162 from Edmonton to Toronto, and Air Canada Flight 7460 from Toronto to Charlottetown. As of today, we currently have 3 active cases of COVID-19 in the province. Since the pandemic began in March, we've had a total of 64 cases of COVID in PEI, and all our cases are travel-related. And now, around the world, there are over 40 million cases of COVID-19, and that's more than our entire population here in Canada. And we remember when we reached 1 million, and to see that over 40 million cases now is significant. In Canada, there have been over 200,000 cases, and we're getting close to 10,000 deaths, so 9,800 deaths in the country. Last week, there were over 16,000 new cases of COVID-19 in Canada, which is a 3% increase from the previous week. There's been an increase in the number of hospitalizations, up 35%, and in ICU admissions, up 17% across the country. British Columbia experienced a 25% increase in cases last week, declaring that they are dealing with the onset of a second wave of COVID-19. Saskatchewan and Manitoba are seeing a large increase in cases, along with Alberta, Ontario, and Quebec. The largest number of most recent outbreaks in Canada are reported in long-term care and retirement residences, schools and childcare centres, as well as food, drink, and retail settings. We continue to see regional lockdowns and significant restrictions on gatherings and public events and services in some jurisdictions. The second wave is presenting different challenges, given that schools and businesses are open. We know there are no quick answers and that COVID-19 is not going away anytime soon. I thank Islanders every day for adopting the public health measures that will support a sustained response while balancing the health, social, and economic impacts of this pandemic. New Brunswick continues to deal with the 2 outbreaks of COVID-19, one related to a special care home in Moncton and a community outbreak in the Campbellton region. New Brunswick has reported a total of 104 cases in the past 2 weeks, including a death in the Moncton area. The Campbellton and Moncton regions continue to be in the orange level of alert, meaning only essential travel can occur in and out of these areas and some activities are restricted. And our colleagues in New Brunswick are working tirelessly to contain the spread of COVID-19. I ask all Islanders who travel to New Brunswick in any jurisdiction in Canada or elsewhere to follow the public health measures and rules that are in place. We must work together to combat COVID-19. Our individual actions matter, and even more so, our collective actions are important. It is encouraging to see even more Islanders wearing masks and face coverings in indoor spaces. Wearing a mask in public is becoming much more of the norm for people here in Prince Edward Island. Thank you to the many Islanders who are choosing to wear a mask in indoor spaces. You're choosing to provide another layer of protection against COVID-19. Masks are not the first line of defense against COVID-19, and wearing a mask does not replace other public health measures that are effective in breaking the chain of transmission. When wearing a mask, it is important that you maintain a physical distance of 6 feet from other people who are outside your household. As we have discussed in previous briefings, our office will continue to monitor the local COVID-19 epidemiology and the evidence on the effectiveness of wearing non-medical masks. As the season changes and we prepare for cooler fall and winter temperatures, we need to think about how this impacts the spread of COVID-19. As we plan to add layers of clothing for cooler weather, we also need to add other layers of protection against COVID-19. In addition to keeping our circle of contacts small and wearing a non-medical mask to reduce the risk of COVID-19 where physical distancing is not possible, other layers of protection include staying home when not feeling well, maintaining good hand hygiene and respiratory hygiene, cleaning and disinfecting frequently touched surfaces, and maintaining physical distancing. When attending events, please remember that just because you know other guests does not reduce your risk. As colder weather shifts our activities indoors, Islanders need to be even more vigilant about following public health practices. We must all do our part by collectively staying apart by at least 6 feet. We all have access to a great deal of information about COVID-19, to the point I've heard it described by some as information overload. There are news channels, radio, numerous social media platforms, all broadcasting information about COVID-19 all day. Some of this information is accurate, but there's some that is misleading and some false. Our office is aware that misinformation about COVID-19 is circulating in our province on many platforms, including social media. And while technology and social media are being used on a large scale to keep people informed, safe, and connected, the false information may jeopardize measures to control the pandemic. We know that misinformation comes in many different forms from many sources and may make different claims. It can be challenging to determine when information, especially health information, is taken out of context and is not factual. I encourage Islanders to get their information from trusted sources such as the Public Health Agency of Canada, the World Health Organization, provincial and municipal COVID-19 websites, healthcare organizations, and reputable national organizations representing healthcare professionals, to name a few. I'd like to just take a couple of minutes to compare influenza and COVID-19. There is information circulating that suggests the pandemic may not be different than the seasonal influenza. But while influenza and COVID-19 have some similarities, the risks associated with the new coronavirus are higher than the seasonal influenza. The viruses that cause COVID-19 and influenza have varying degrees of presentation, ranging from no symptoms to severe symptoms. Common symptoms of both illnesses are fever and chills, cough, shortness of breath, fatigue, sore throat, runny nose, muscle aches, and headache. COVID-19 can cause a sudden change in or the loss of taste of taste or smell, which is not associated with influenza. But both viruses are spread by close person-to-person contact within 6 feet and is spread by droplets when an infected person coughs, sneezes, or talks. COVID-19 is generally more contagious than influenza. It has been associated with more super spreader events than the influenza virus, meaning the virus spreads easily and quickly to a large number of people. Both COVID-19 and the flu can result in serious complications and illness, especially with older adults, people with underlying medical conditions, and pregnant individuals being at higher risk. Healthy children are at higher risk of complications with influenza. School-aged children with COVID-19 are at higher risk of multisystem inflammatory syndrome, a rare but serious complication. However, each year there is a vaccine for influenza, which protects against 3 or 4 strains of influenza that are likely to be circulating. And there is no vaccine yet to prevent COVID-19 complications. The flu shot does not protect against COVID-19. In a typical year in Canada, there are approximately 40,000 detections of influenza and 3,500 deaths associated with influenza. And to date, there have been over 200,000 cases of COVID-19 in Canada and almost 10,000 deaths. So really 3 times as many deaths compared to influenza in Canada. To date, the data for COVID-19 suggests that 80% of infections are mild or asymptomatic, 15% of infections are severe, requiring oxygen, and 5% are critical, requiring ventilation. The proportion of severe and critical illness related to COVID-19 is higher than we would see for influenza infections. While these 2 illnesses do share some common characteristics, clearly the risk of developing serious illness and dying is higher with COVID-19. While we continue to take steps to protect ourselves from COVID-19, it is important that Islanders get the flu shot to protect themselves against seasonal influenza. Influenza vaccine is available by appointment through the province. Call 1-844-975-3303 to book an appointment with public health in your area, or contact your local pharmacy or your physician or nurse practitioner to arrange to get the flu shot. We are fortunate to have limited transmission of COVID-19 and PEI. However, the virus is knocking on our door. We know this virus can spread quickly and easily under the right conditions. The virus has not gone away. We know it can hide and spread. So individually and collectively, we can control the next phases of our COVID-19 journey. And as we watch the rest of the country, especially outside the Atlantic bubble, dealing with increased number of cases, we must remain committed to working together to do what we can to avoid widespread transmission and a sharp increase in cases like they've seen around the country. Our focus will continue to be balancing the need to keep Islanders safe with the need to minimize societal and economic impacts. We want to slow the spread of the virus and balance it with keeping as many things open as we possibly can. As we continue on this journey together and caring for each other, our families, colleagues, and community, we will be looking out for each other. Please continue to be compassionate. Please be patient, and please be kind. Thank you. And I'll open it up for questions.
Gabrielle Dumont, Radio-Canada.
Bonjour, Dr. Morrison. Alors, vous avez mentionné tout à l'heure ce nouveau cas de la COVID-19 qui a été annoncé à l'île du Prince-Édouard. Est-ce que vous pourriez nous donner des détails concernant ce nouveau cas en français, s'il vous plaît?
Bonjour. Aujourd'hui, on annonce un nouveau cas de COVID-19. C'est une femme 20e, à peu près 20 ans, et puis elle vient de retourner du travail hors de la boule atlantique. Et puis son premier test était négatif, et puis c'était positif son deuxième test. Elle est chez elle et elle auto-isole chez elle avec les symptômes qui ne sont pas sévères.
Et merci. Et vous avez mentionné aussi une mise en garde. Vous avez mentionné une mise en garde des gens qui ont pris un vol d'Air Canada. Est-ce que vous pouvez aussi nous dire cette information en français?
OK. Et puis, si quelqu'un a voyagé sur les vols le 13 octobre, il faut faire attention si on a les symptômes de COVID-19 et si il a des symptômes, il devrait être testé. Et c'est les vols Air Canada, vol 162 de Edmonton à Toronto et aussi le Air Canada vol 7460 de Toronto à Charlottetown, même journée.
Merci beaucoup.
Jessica Doria Brown, CBC.
Hi there, Dr. Morrison. Just wondering whether what you'd like Islanders to take home from the fact that this person's first test result was negative and then ended up being positive several days later.
Hi, Jessica. I think we've talked about it at different times throughout the course of the pandemic that I think it's a reminder that to Islanders, to all of us, that a negative test does not mean that it won't become positive at a later date. And that's why it's so important that the public health measures and the isolation are really so key. And I think it demonstrates that it's not the first time that that's happened, but it's certainly a reminder to everyone about why one test doesn't mean you can just be out of self-isolation and because it does carry the risk with that of changing to positive a few days later or even the next day.
And are there any additional details you could offer on this newest case? Specifically, has this person been self-isolated since they arrived back on the island?
So they, I think they're in self-isolation. They had very few contacts, close contacts, and they were all followed up. So they, just a handful of contacts. They all were tested, as I mentioned, and they are negative, but all the close contacts are also in self-isolation, and they will remain there as well. And their initial tests have been negative, and they will be retested as well. And that could include family members, for instance.
Okay, thank you very much.
Alison Jenkins, The Guardian.
Yes, hello. I had a couple of questions about mental health care on the island, just to kind of follow up on some of my colleagues' reporting recently. The psychiatric unit in the Prince County Hospital is currently set up as a psychiatric urgent care clinic. Is there any plan for that to become an inpatient clinic again, or a unit?
Alison, I think, this is really a COVID update here today, and I'm sure that we can provide you some of the details. I am not familiar with what the plans are for the Prince County mental health unit there, but we certainly can follow up later on by email.
Sure, just asking since it is a COVID-19 measure that it was emptied. So I just thought it was pertinent to the briefing. Additionally, I'm hearing in court that the addictions counselors haven't been able to visit the provincial jail. Is that going to be part of the new normal that they are allowed back, or what?
So certainly I can follow up with that. And I know Marion Dowling isn't here with us today, and she might be better able to answer that initial question you had, Alison. But we have had a tabletop exercise actually with corrections within the last week, and so I will have to follow up in terms of the addictions counselors going into corrections.
Okay, thank you very much. That's great.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. Vous avez parlé longuement là, de la désinformation qui circule à propos de la COVID-19. Est-ce que vous pourriez répéter ce que vous avez dit, notamment sur l'importance des sources en français, s'il vous plaît?
Okay. Bonjour. Alors, je pense en anglais, j'ai mentionné qu'il y a tellement d'informations à propos de COVID-19 dans toutes les plateformes, vraiment. Et puis, il y en a l'information qui n'est pas... c'est pas vraiment... c'est un peu... des fois, c'est vraiment pas vrai, mais il y en a d'autres qui est, je ne sais pas comment vous dire, misleading, mais c'est pas d'une source qu'on recommande. Alors, j'encourage les insulaires de chercher sur les sources d'information de l'Organisation de santé globale, World Health Organization, de l'Agence santé publique du Canada. On a les sites pour COVID-19 provincial et municipal. Et puis, parce que c'est important qu'on reçoit l'information qui est le meilleure information pour protéger pas seulement nous autres, mais la communauté en même temps. Alors, j'encourage avec toute l'information qu'on lit et on regarde les choses qui sont les plus informées que possible.
Et j'aurais un follow-up sur cette question. On voit, vous avez parlé notamment de la différence entre la grippe et la COVID-19. On voit aussi passer beaucoup d'informations sur les tests PCR et sur les réseaux sociaux des gens qui disent que quand on est testé, en fait, on n'est pas malade, on n'est pas contagieux, qu'il y a beaucoup de faux positifs. Qu'est-ce que vous pouvez dire aux insulaires sur ces informations?
Alors, c'est une question à propos du false positives du COVID-19. Juste pour que...
Est-ce qu'il y a des informations, des fausses informations à propos de tests qui seraient en fait que des faux positifs et qu'il y aurait beaucoup moins de gens malades, des fausses informations qui circulent? Est-ce que vous pouvez nous expliquer ce qu'il en est?
Oui, et puis je l'ai vu aussi, cette fausse information, mais on a les tests qu'on utilise ici au Canada et à l'île du Prince-Édouard sont les tests qui sont standardisés partout au pays. Ils sont... j'ai beaucoup de confiance dans nos tests. On teste, comme j'ai mentionné, on teste beaucoup insulaires ici à l'île du Prince-Édouard. On teste le deuxième plus grand nombre de personnes per capita au pays. Et puis, on reçoit, la plupart sont négatives. Et puis, on n'a pas beaucoup de positifs. Et quand j'ai un positif, j'ai beaucoup de confiance dans le résultat. Alors, on n'a pas un problème ici à l'île du Prince-Édouard à avoir des faux positifs. Et j'ai confiance dans le système des PCR tests ici et puis vraiment partout au pays. Alors, il y a plein de choses sur l'Internet qu'on peut lire, mais on doit regarder le nombre de personnes qui sont testées ici au Canada, le nombre de cas positifs et aussi le nombre de personnes qui sont recouvertes.
Merci beaucoup.
Rachel Collier, The Graphic.
Hi. I'm wondering today, Dr. Morrison, if you have any information about when common rooms might open within PEI assisted housing locations. I've heard that some aren't open and they're just awaiting CPHO direction, but I'm not sure if that's exactly what's happening. Just curious what you might have to say.
Hi. So actually, it was interesting. That same question came up earlier this morning before I came in, and I know there's been discussion around how can some of these common rooms, especially for instance in seniors' homes, work safely for everyone in these residences. So I'm actually going to be following up because there has been some direction already provided. So I think we need to, if there's still questions about it in these common areas, then I think we need to highlight it and update some of the guidance around that on the website. So that will be something I'll be taking back to the team and making sure if there have been some questions that we address those.
Okay, and I guess, like, from what I understand, some common rooms are open right now, but others aren't. What do you kind of know about that situation and why that is?
Well, it may be very much how it may depend on the common room and what the particular building or facility is comfortable with. So when we give our guidance, it would be about making sure that people who aren't sick are not congregating, making sure there's enough cleaning supplies. Is there a setup where people can still maintain physical distancing but still be able to participate? So I think it may be dependent on the individual facility and how they're working that out. We have told certainly any organizations, if they have questions about having an operational plan to have gatherings, that we can certainly help advise them if they have questions, and we'll continue to do that.
Okay, thanks for that.
Okay.
Louise Martin, CBC.
Hi, Dr. Morrison. Appreciate your time today. I just wanted to go back to a change operational plans that happened last week at some PEI intermediate schools. And I'm just wondering, and that included moving from classroom to classroom as opposed to the teacher coming to the student's classroom. I'm just curious about the timing in changing that guidance at some intermediate schools. Given that we're just coming into cold and flu season, and that certainly would mean more crowded hallways, and also just following up on what you said last week with potential spot checks at schools. Has that started to happen?
So I think the Department of Education and the Public Schools Branch, School Commission, made some of those changes to try to still maintain cohorts but have children moving a bit more than the teachers. They felt that some of the students benefited from some movement from class to class, but still trying to be safe in doing so. So I think it was really the schools themselves that made some of those changes. And in terms of the inspections of the COVID-19 inspections in the schools, they started, it may be today, it was starting this week, possibly the first one's being done today, and they will be going around to different schools and watching and looking and really trying to support schools in their operational plans and again, proactively trying to prevent issues if their COVID-19 was introduced into that school.
Just to clarify a point you made, does any operational plan change at a school have to be cleared through the Chief Public Health Office?
Well, I think the operational plans for the schools were all initially looked at by a team of people, including people from our office as well as the school boards. And this last one, there may have been conversations with someone in my office, but I did not look at those changes myself.
Okay, and my second question is about the cases in New Brunswick. You touched on it briefly, and I know yesterday that province announced that they were expected in the Moncton area, because the case count is decreasing, to return to the yellow phase of recovery. And I don't believe the same situation in Campbellton at the moment. But just to speak to Islanders about travel to New Brunswick once again, as we approach sort of the holiday season, a lot of Islanders, as you well know, will be crossing the bridge to do perhaps some holiday shopping or visit family across the bridge.
So as you mentioned, I anticipate that in the Moncton area, they will move from their orange zone to a yellow zone later this week, and but that it will likely remain in orange for the Campbellton area a bit longer. And I think what's happened in New Brunswick in the last couple of weeks is a good reminder for all of us that regardless of where we're going or where we're traveling, it's important to wash your hands. Put on a mask if you're going in indoor spaces, and especially if you can't maintain 6-foot distance, and keep your 6-foot distance wherever possible. And that, of course, applies outside the bubble, but it applies within the bubble, and it applies right here within Prince Edward Island. So I think the same important public health measures are being spoken about in all our provinces.
Thank you so much.
You're welcome. I think that's it. Thank you very much.